is your Cna for today. I'll be cleaning your, I'll be doing your back rub and
bed bath, partial bed bath.
partial bed
For
bath.
CNA, partial bed bath, one of Prometric skill.
Is that okay for you?
That's fine, ma'am.
Okay, so I'll be washing. Can I know your date of birth and name, please?
My name is Miss Henderson, date of birth October 4th, 1942.
So I'll be cleaning my hands and giving back my supplies.
Okay. Guys, we do these types of videos for the teaching purposes. This is one of Prometric skill, partial bed bath. So I am teaching a CNA class and the student is demonstrating. I have demonstrated the skill and each one of the students is re-demonstrating it so we can evaluate them. So the student got all her supplies. She got a privacy blanket. She has several privacy towels. She has several gloves, several washcloths. She has soap, lotion, basin, and water. Okay, so she's following infection control. She verified her patient using the two identifiers, name and date of birth. Have you provide privacy for her? She's pulling her privacy curtain. She's raising the bed to working level to maintain proper body mechanics. And she will be locking the wheels for safety measures. Guys, when you're doing this skill, please communicate with your patient because Prometric, they always kind of tag you if you don't communicate with your patient. You have to communicate with your patient clearly and precisely. Checking the temperature of the water. The water temperature is fine.
I just wanted you to check the temperature of, is that okay for you?
That's fine, ma'am. I will be placing a privacy blanket over my patient to provide additional privacy and warmth for the patient. Ensuring not to shake the privacy blanket because we don't want to shake. Always open. The next thing the student. So guys, the Prometric skill, the partial bed bath. The partial bed bath for Prometric, according to their protocol and policy, is cleaning the face. Yes.
Yes.
Cleaning the eyes, the inner canthus to the outer canthus, cleaning the face without any soap. Cleaning the neck, cleaning the upper torso and one arm. Those are the different areas according to Prometric that we're doing, okay?
No, you don't need to.
No, that's okay. I think you have enough barriers there. That's fine, so should be. So now you're getting ready to clean her eyes. The inner, are you using the four corners or?
Yeah, I'll be using four corners.
Okay. So the student is using the four corners. She's going to open the gown. Make sure you provide privacy for your patient. You don't ever want to expose your patient, right? Sometimes we have a tendency to do that in the classroom because we are trying to use proper visualization so other students can see the skill that we are doing, but we never want to expose a patient.
First.
The inner eyes, inner canthus to outer canthus, one swipe, switch the cloth, very good. good. Guys, if you like these types of videos that we provide on YouTube, please give these videos a thumbs up. Please drop your comments in the comments section of the video, and give a thumbs up for the CNA student. They'll be graduating in another week or so. So we do these shorts and these short videos just to kind of provide some type of education for them. So you are cleaning the neck now. She'll be cleaning the patient's neck, so she's going to be using soap with the next area that she's going to be cleaning.
Not the mass, the instrument. These ones. For the 20K.
I think she's doing pretty good, right?
Yes.
She's using the Renzo water. She's following infection control, providing privacy. Good morning. Welcome back to my YouTube channel. Thank you again for tuning in. This is Miss Henderson. Thank you for tuning in. Thank you to my returning subscriber. Thank you for those who have been tuning in to this channel. I thank you so much for your gratitude and for supporting this channel. So today we are doing something exciting. I am going to be demonstrating how to complete a partial bed bath. So the partial bed bath is one of Prometric's skill, and so what are the different areas we are cleaning when we're performing a partial bed bath? We are cleaning the patient's face, their neck, part of the upper torso, one arm, and the posterior back. So as always, if you like these types of videos and these types of content, please consider subscribing to my YouTube channel. Please like and share and give this video a thumbs up. I would really appreciate it. So today I have the following equipment. I have a privacy blankets. I have several towels to use as a barrier. I have soap, I have a few pairs of gloves, and I have several washcloths that I will be using. I also have a gown to change patient. So that being said, let's go. Let's start. So the first thing I want to do is that I want to, can I come in? My patient said yes, I can come in. Hi, good morning, Mr. Jones. My name is Miss Henderson, and today I'm your CNA, and I'm here to perform a partial bed bath to clean you up. Is that okay with you? Patient said yes. I'll be right back. I'm going to go wash my hands, gather my supplies, and come back. So I go, I wash my hands, I gather my supplies, and I come back to the patient. So when I come back, what am I going to do? I am going to check my patient's ID band. Hi, you're Mr. Jones. Hi, Mr. Jones. What is your date of birth? October 5th, 1949. Okay, great. So at this time, I want to lock my bed for safety. I want to raise my bed to working level to maintain proper body mechanics. I want to lower the side rail that I will be working on. And I think pull my privacy curtain. You don't want to forget that because that's very, very important. You need to pull your privacy curtain. So that being said, I can go right ahead now and place my privacy blanket over my patient, right? Good. So I have my privacy blanket over my patient. The next thing, I want to place a barrier under the head of my patient. That way to protect his pillow from getting soiled. At this time, I will also go ahead and place another barrier under my patient's arm. Make sure you cover your patient for privacy and maintaining his dignity. At this time, I'm going to get my water. I'm going to check the temperature of the water, and I'm going to have Mr. Jones check the temperature of the water. Mr. Jones, can you check the temperature of the water? Is it too hot? Is it too cold? My patient said the water is fine. At this time, I'm getting ready to do the actual skill. So I am going to be applying my first gloves on. So make sure you communicate with your patients. Mr. Jones, how was your night? Did you rest good? Are you in any pain? Are you in any discomfort? Your patient said no, he's okay. So I have my gloves on. So I'm going to start by cleaning his face. So when we are cleaning the face, we don't really use soap on the patient's face. So there is two ways you can use this washcloth. So I like to use the four corners, because with the four corners, I have 4 wipes. 1, 2, 3, 4. That's one method. The other way is to make a mitt. When you make a mitt, you only have 2 wipes. 1, 2. So I will be using the 4 corners for this skill. So, use the first cloth, the first fold. You clean the eyes from the inner canthus to the outer canthus, one swipe. You tuck that in. Use the second portion to do the second eye. One inner canthus to the outer canthus. Tuck that in. So that's the face. Now I am going to use a towel to dry my patient's face. So you kind of basically pat and dry. So I have completed the face, so now I am going to do the patient's neck. So for the neck, we are going to be using soap. So just squirt some soap on the washcloth. Jones, I'm cleaning your behind your ears, and then I'm going to be doing also your neck. Is that okay with you? He said yes. Okay. How you doing? Are you in any pain? Are you in any discomfort? He said he's doing fine. So this is our soapy cloth. Now I'm going to use another basin with rinsing water so we can 1, 2, tuck that in. Now I'm going to be drying my patients. Are you feeling any pain? Are you feeling any discomfort? My patient said no. So at this time, I am going to proceed to do the patient's, I'm going to do the upper torso and also I'm going to do the hand. So at this time, I am going to take the gown off of the patient. Jones, I'm just taking your gown off so I can get to your arm. Is that okay with you? Are you feeling any pain? Are you feeling any discomfort? He said no. Okay. Make sure you cover your patient so you don't overexpose them. It's very hard when you have to do the skill on a mannequin, but you have to try because this skill is done on a mannequin with Prometric. So I'll take out the dirty gown, I'll place it into the hamper. At this time, I am going to take off my gloves. I'm going to wash my hands and I'm going to get some new water. So take the gloves off, I throw it into the trash and I got new water. So I'm going to have my patient check the temperature of the water again. So is it too hot? Is it too cold? He said it's perfect. So we are going to go ahead and apply a new pair of gloves so I can do his arm and upper torso. Guys, if you like this type of content and these types of video, please support this channel. Please consider subscribing to this channel. Please like and share these videos to help other CNA students. So I find these videos are very helpful for students because some people are visual learners. They learn by just seeing somebody, you know, doing something. So I'm gonna go ahead and clean my patient upper torso. And we are going to be using soap. So try to cover your patients as much as possible so you maintain the privacy. But as for this video demonstration, I'm just going to expose it so the students can see. That's sort of soapy water. We have our rinsing water. Are you feeling any pain? Are you feeling any discomfort? He said no. I'm going to dry my patient, pat dry. Make sure you cover your patient to maintain his dignity and warmthness. So now I am going to probably change the water again because I'm doing his arm. So I change the water again. I take off my gloves, wash my hands, apply a new pair of gloves, and I'm going to go ahead and clean his arm. So I am going to proceed to clean his arm first, clean to dirty, then I'll do the arm, then I'll do his armpits. So 1 stroke down, tuck that in, 1 stroke down, tuck it in, and 1 stroke. This is our soapy water. This is going to be our rinsing water. 1 stroke down. How are you feeling, Mr. Jones? Good? Yes, I'm good. All right, just going to dry your arm. At this time, I am going to proceed to take off my gloves, wash my hands, and get a new set of water because I'm getting ready to do the scale on the back to clean the patient's upper back. So change the water, take your gloves off, wash your hands, and apply a new pair of gloves. So in order for me to clean my patient's back, what do I have to do? First, I have to lower the head of the patient. Mr. Jones, I am going to be turning you on that side. I have my side rails up. So can you please help me so I can, you can hold on to the side rail for support. I'm going to move you in 3 segments. 1, 2, 3. I'm going to cross my patient's leg for proper body alignment. I'm going to cross his arm. And now I'm going to proceed to turn my patient to the side. On a count of 3, Mr. Jones, I'm going to turn you on that side. 1, 2, 3. Just please hold on to the arm. Thank you. At this time, I'm going to place a barrier under my patient's back just to protect the linens from getting soiled. So I have new water. Clean the upper back. 1, 2, 3, 4. This is my soapy water. I'm going to proceed to use rinsing water. I am going to dry my patient's upper back. How are you feeling, Mr. Jones? Are you cold? Are you comfortable? Are you experiencing any pain, any discomfort? He said no, he's okay. Mr. Jones, I'm going to go ahead to turn you back onto your back. Is that okay with you? On a count of 3. 1, 2, 3. So at this time, I'm going to remove my gloves and apply a new pair of gloves, and then I am going to change the patient's gown. That's the last thing you want to do. I have a new clean gown here. I'm just going to on this. Help me. So using proper body mechanics, I'm going to go on the other side so I can apply his gown properly. Good, very good. Nice and clean. Clean. Mr. Jones, can you help me? I'm just going to lift you up so I can tie your gown to that side. We'll do it from the other side. Makes better sense. So guys, that's it for this video. I cleaned Mr. Jones' face. I did his behind his ears. I did his neck. I did his upper torso. I did his arm along with the armpit and the posterior upper back. At this time, I am going to go ahead and remove this privacy blanket, dispose of this into the hamper. At this time, I am going to dispose of my basin. I'm going to wash this and disinfect it for 3 times. Then I am going to take a dry paper towel, dry it, and place it back into its designated area. I'm going to remove everything, dispose of it. Then I'm going to take my gloves off, dispose of this into the trash, wash my hands 15 to 20 seconds, and I come back to my patient. Mr. Jones, you're nice and clean. How is it? Feeling okay? At this time, I'm going to place my call bell into Mr. Jones' hand, and I'm going to lower his bed for safety. Mr. Jones, would you like to read a magazine? Would you like to watch TV? My patient said that he's fine. Would you like your head to be elevated a little bit more? He said yes. I placed the call bell within close reach, lower the bed, and also I need to raise the side rail while I'm walking away from my patient for safety. And call bell within close reach, the bed in lowest position. I need to remove the privacy curtain. At this time, the bed is in lowest position, and I am going to take a couple seconds and review my scale just try to conceptualize that I have hit on all the different elements of the skill, and I think I have. So at this time, I will tell my evaluator that my skill is completed. So my skill is now completed. So when you say your skill is now completed, you cannot go back and make any type of corrections. Guys, this is it for this video. I hope this video can help you and deepen your understanding of performing a partial bed bath, because it's one of the Prometric state exam. Thank you for watching, and please subscribe. Please give me a thumbs up. Please like and share, and I'll catch you in the other video. Bye for now.